Welcome to our prenatal series.
My name's Natasha.
And I'm Melissa.
We are the two AmeriCorps members at the 16th Street Clinic in the Women's Wellness Department.
We help educate first-time moms and provide prenatal care and information to help facilitate a healthy pregnancy for our patients here at the 16th Street Clinic.
Before we begin, if you have any questions or comments throughout the class, please respond to the link that we have in our bio.
It is completely confidential, and we will respond to you as soon as we can.
If anything is urgent or an emergency, please call the clinic as soon as possible. We will be continuing to make educational videos for you all to watch regarding maintaining a healthy pregnancy. This video's topic will be about postpartum depression. Once again, if you have any questions, please click the link in the bio for a survey in which you can ask your question. Today we will be talking about the baby blues, postpartum depression, and what to do and how to ask for help. After giving birth, you will go through many changes. These can include emotional changes, physical changes, and starting a new life with your newborn. Today we will be focusing on the emotional changes that can occur after giving birth. These emotional changes after birth are due to hormones and can affect your mood. This is because after pregnancy, your hormone levels quickly change back to pre-pregnancy levels. This drastic change can make some women feel a bit different. Some may experience/feel these changes more than others, and some may not feel any at all. It is variable. First, we are going to discuss the baby blues. This is a very common mild depression that women experience after birth. This can be due to the lack of sleep, hormonal changes, the challenge of childbirth, and the change in lifestyle. This occurs within the first 2 weeks of birth and should not persist any longer after that. The signs and symptoms of mild depression in the baby blues include trouble concentrating or feeling confused and distracted, feeling irritable or angry sometimes for no reason, crying often for no reason, and feeling sad frequently. What should you do if you start feeling this way? You need to be open and honest with others about your feelings. Do not shy away from telling others how you feel. You should be realistic about your needs in regards to rest, recovery, and support after giving birth. You need sleep. It is important that you rest and sleep whenever the baby sleeps. Do not be afraid to ask others for help for tasks, even involving housework or childcare. Your support system wants to be there for you and your newborn. Also, be kind to yourself. You just gave birth to a newborn and made it through a huge milestone. Lastly, if you need to speak to your provider and ask for additional help or resources, do not be afraid to ask for help.
Now we're going to talk about postpartum depression. Postpartum depression is defined as depression after childbirth, usually due to hormonal changes, fatigue, and adjustment to motherhood. This is different than the baby blues because it is stronger, lasts longer, and starts later postpartum. More than 10% of mothers will experience postpartum depression after giving birth. These are some signs and symptoms of postpartum depression. These include 1. Questioning of motherly abilities. 2. Feeling alone, vulnerable, or overwhelmed. 3. Distancing oneself from family, friends, or even her partner. 4. Lack of interest in things or loss of energy. 5. Trouble sleeping and restlessness. 6. Problems producing breast milk. 7. Feelings of guilt, fear, or worthlessness. 8. Headaches and bowel problems. 9. Difficulty concentrating. And 10. Thoughts of suicide or harming the baby. What should you do if you're experiencing some of these symptoms? You should speak up. Talk about your feelings with friends, families, your partner, or someone you feel comfortable with. Even speaking to nurses, social workers, or other healthcare providers. Everyone wants to help you feel your best. Be easy on yourself. It is important to ask for help when you need it, and learn your needs and what will be the best outcome for you and your baby. And talk to your provider. They can help you get connected with the correct support if needed. They can also prescribe antidepressants medication to help your symptoms.
Once again, if you have any questions, please respond to the link in our bio and drop your questionnaire and we will get back to you. It is completely confidential. Please consider following the clinic on social media, as we will be posting educational updates there as well. Thank you for watching.